The topic that I would like to talk about today is safe patient selection and use of TNE for PEG insertion in MND patient. Patients with motor neuron disease frequently have dysphagia, which lead to poor oral intake and malnutrition and may eventually require a PEG for nutrition. PEG using transoral endoscopy can be associated with significant aspiration and respiratory risk for motor neuron disease patients. A recent publication from the Cambridge suggests lower complication rate using an unsedated, seated technique with TNE in patients with chronic neurological illness. James Cook University Hospital endoscopy unit received relatively large number of PEC referrals for MND patients. In January 2019, we introduced a gastrostomy assessment pathway to stratify MND patients into high, moderate, or low risk category, as what you can see on the figure. This was based on a traffic light system using another center with all high-risk patients having PEG placement with TNE. The results we gained is all MND patients who require PEG were discussed in MDT. Following introduction of the pathway, 64.5% of patients were identified as high risk. One case were moderate risk and 29% were low risk. One case was not classified given the patient had dementia and was not able to complete lung function test, which is crucial in categorizing patients. In the high-risk group, 95% of the patients had TNE PEG insertion, with 90% cases unsedated. One case had transoral PEG with sedation, and MMD nurse was there to present to provide NIV support. All the moderate and low risk group have transoral endoscopy, and most of them were sedated. In all the cases, a failure rate of 9.7% was attributed to unable to safely identify the PEG site. We will compare the outcome of peri-procedure and mortality before and after impose of traffic light system. There is significant reductions in respiratory compromise from 40% to 3.2. Respiratory arrest from 2.9% to 0, and 30 days mortality from 8.6 to 3.2. The study provides a snapshot of the safety of traffic light system to re-stratified MND patients for a safe and effective technique PEG placement. We highlight key aspects of care that can be optimized to reduce peri-procedure complication and mortality. National post-procedure 30 days mortality of PEG insertion is reported as 8%. Our 30 days mortality rate, 3%, is well below compared to the national level. As a result, we recommend use of traffic light system with unsedated, seated TNE as the method of choice for PEG insertion on high-risk MND patients.